Hello everyone. I hope you have good time today, and we are finished the topic of astrology and moving into soft tissue. In soft tissue, we will first discuss the neck region and then enter the facial region. The neck region is an area between the head and the trunk. Anatomically, its upper boundary of the neck is a line that connects the angle of mandible, superior knuckle line, and the external occipital protuberance. In addition, the mastoid process is in this line, and in some texts and some references it is considered as one of the points of superior border of the neck. And what about the inferior border? Is informed by the jugular notch of the sternum, the clavicle, and the acromioclavicular joint. A line that joins this joint to the spinous process of the seventh cervical vertebra is the exact boundary or inferior border of the neck. Okay, everyone, now regarding the importance of anatomical elements or diagnostic structures in the neck, we should examine them and start from the superficial level. Let's imagine we have a section and we want to dissect it, or we have a cutoff and we want to dissect it. First, we remove the skin. Beneath the skin, there is a superficial fascia, and if we go deeper, we reach the deep fascia. So, the first layer we encounter in the neck is the superficial fascia, which contains a number of structures inside it that we will discuss about them. The structures that lie within the superficial cervical fascia pass through the platysma or platysma muscle. There is a vein here, and the external jugular vein, it is the name of this vein that is in the superficial fascia. In individuals, you can see the external jugular vein in the lateral aspect of the neck, and also we have the superficial branches or cutaneous branches of the cervical plexus, which lie within this superficial fascia. So we can conclude that in the superficial fascia we have external jugular vein, cutaneous branches of the cervical plexus, these are cutaneous nerves, and in addition platysma muscle. One of the structures we mentioned that lies in the superficial fascia is platysma. This is a thin, broad muscle located in the anterolateral part of the neck. This muscle arises from the fascia covering the deltoid and pectoralis major muscles in the upper part of thorax and also in the upper part of upper limb. Its fibers begin from the deep fascia of these muscles and run upward and slightly medially toward the lower border of the mandible. It inserts into the lower border of mandible the skin and subcutaneous tissue of the lower of the face and blends with the muscles in that region. Its attachments or attachment of platysma can create certain skin folds or wrinkles, and it also has an aesthetic aspect or cosmetic significance. If it becomes paralyzed, the skin of these parts of the neck loses tone and hangs in folds. It is an interesting muscle that is within the superficial fascia. Okay, the external jugular vein that you can see and find in this picture, I show you in the right picture with blue circle. It is in the superficial fascia outside the sternocleidomastoid muscle. This vein is located on both sides of neck uh, within the platysma region or deep to the platysma region. In the dissection, in the cutoff dissection, we remove the platysma in that region or area to reach this vein. It runs superficially across the large muscle called sternocleidomastoid. You can find it in the picture, and I will explain it later. This vein is formed superiorly at the angle of mandible by the union of the posterior auricular vein and the posterior division of retromandibular vein. You can see in the left picture these structures and these two veins, posterior auricular vein and posterior division of retromandibular vein. These veins join together and form the external jugular vein. It then descends and drains into the subclavian vein and the jugular venous system in the region. In this region, this vein drains into the subclavian vein or a region that subclavian vein and internal jugular vein meet together. Okay. This vein or external jugular vein receives some branches and this vein itself empties into the main veins of the neck or subclavian and internal jugular vein. In the right picture, you can see the anterior jugular vein. I show you with black circle. It is in the anterior aspect of neck, and it is clear in the picture. Another element that is in the superficial fascia is cutaneous nerves, or superficial branches of the cervical plexus. These nerves are a lesser occipital nerve, great auricular nerve, transverse cervical nerve, and supraclavicular nerve. In this image, these yellow filaments are the cutaneous branches that you can see. When we reflect the skin, there are 4 branches, and here I will present them to you in the most detailed way among the models. Their names in order I said you, and from superior to inferior, you can see in the picture respectively, and learn the name of these nerves. Okay, we now reach the deep fascia of the neck. The neck, the deep cervical fascia of the neck is so organized that it actually gives order to the structures. In fact, it functions like packing material, a connective tissue layer that invests the structures and organize them in the neck. It is a very special tissue in the neck. It is essentially divided into 2 layers, a superficial layer and a deep layer. The superficial layer is named investing layer or outer investing layer, which means it surrounds and covers the structures and is superficial in comparison of a deep layer. The deeper layer divides into various parts and different compartments. Please look at this image. It shows the deep facial layers of the neck. It has a superficial layer and deep layer. Superficial layer or investing layer attached around the mastoid process and enclose the muscles superiorly, and it comes down and attached to the acromion, clavicle, and monoprium of sternum inferiorly. And what about the deep layer of deep fascia, deep cervical fascia? A deep layer divides into 3 compartments. You can see with different colors here. At first, peritracheal layer, I show you with green circle. Carotid sheet, I show you with red circle. And paravertebral layer, I show you with black circle. These 3 compartments are 3 divisions of the deep layer of the deep cervical fascia. And investing layer I show you with blue circle here. picture, the investing layer of the deep cervical fascia is shown. It starts posteriorly from the ligamentum nocae or nocal ligament in the posterior aspect of neck, comes forward, encloses the trapezius muscle, and then the two layers meet again. It continues into the anterior part of neck and enclose the sternocleidomastoid. Then two layers join together, and in the midline they meet together in both sides. In this picture, the blue line is investing layer. In the posterolateral region, you can see that this layer encloses the trapezius muscle, and in the anterolateral region of the neck, you can see it encloses the sternocleidomastoid. In the midline, anterior midline and posterior midline, this layer meet together and join together. In this section, you can see the fascia that enclose the structures in different color. Look at the investing fascia. It is shown as a quite extensive and shiny. From the outer side, bilaterally, the trapezius and sternocleidomastoid muscles are enclosed by the investing layer of deep fascia. The deep fascia then divides into several layers, as I said in the past slides. One of them is the perivertebral fascia, which covers the perivertebral muscles and essentially covers the posterior part of the neck or posterior triangle. It continues and participates in forming the axillary sheath at the end. As you know, the posterior triangle, the brachial plexus exists together with the subclavian vessels, and their course continues into the axilla inside this axillary sheath. You can see perivertebral fascia with yellow or some kind of yellow, yes, yellow color in this picture. It is around the perivertebral muscles of the vertebral column. There is also carotid sheath here, which is present on both sides of neck. In this image, you can see that it encloses the internal jugular vein, common carotid artery, and vagus nerve. It is some circles in the picture in the both sides of neck with maybe purple in the section. And pretracheal fascia is located in front of the trachea. You can see in blue in the picture. These are the branches of the deep layer of the deep cervical fascia. Okay, here you can see the fascia. The investing fascia is also visible. The investing fascia attaches to the mandible, usually at the angle of mandible, and continues inferiorly, forming various spaces. You can see in the picture the investing layer with the green color. The prevertebral fascia superiorly has an attachment that covers the base of the skull, and inferiorly it continues further. Laterally it connects to the axillary sheaths. And the carotid sheath also extends upward and downward from the base of neck to the base of skull. It is on the both sides of neck. And the paratracheal layer is shown with red color. Here you can see in the picture. This picture show you another view of the deep cervical fascia in the neck, and the past slide was another section. This section is sagittal section, and the past slide is a transverse section. Okay, from here we reach the muscles of the neck, which take different positions. We already know the cutaneous muscle of the neck, I mean platysma, and I introduced the platysma to you. The deeper muscles of the neck are arranged in layers. This layered arrangement separates the structures inside the neck so that we can examine them and assess them better and pay closer attention to them. Okay, a very important and well-known muscle in the neck is the sternocleidomastoid. Um, it is named according to its attachment. Sterno attached to sternum, cloido attached to clavicle, and mastoid attached to mastoid process. Sternocleidomastoid. If we examine it from below, it has two heads. The sternal head that arises from the anterior surface of monobrium, and the clavicular head arises from the superior surface of medial part of clavicle. These two heads join together, run upward, and attached on the mastoid process of the temporal bone, and the lateral half of the superior nuchal line. The innervation of this muscle is mainly from the accessory nerve, it is a cranial nerve, 11th cranial nerve, as well as the branches of C2 and C3 of cervical plexus innervate the sternocleidomastoid. And what about the action of this muscle? If it contracts on one side, it brings the head closer to the same shoulder. If both sides contracts, it plays as an essential role in flexing the neck. If we fix the head, it can elevate the sternum and act as an accessory muscle of respiration. Pay attention to its function. From now, I named the sternocleidomastoid with three letter SCM. When I say SCM, I mean sternocleidomastoid. Please learn it. Regarding the relation of this muscle, you can see in the picture at about the midpoint of posterior border of the sternocleidomastoid, the accessory nerve emerges. If we look more carefully, we see that several nerves also emerge from a single point. This point named nerve point. It is the midpoint of posterior border of SCM. From this point, the cutaneous nerves of the neck emerge. I said in past slides, these cutaneous nerves are in the superficial fascia of the neck. Just external to the sternocleidomastoid or SCM, as you can see in the image, is the external jugular vein along with the great auricular nerve, the transverse cervical nerve, and others you can see in the picture. The supraclavicular nerves also emerge just external to the sternocleidomastoid. On the medial side, the structures of the carotid sheath are known. They lie deep to the sternocleidomastoid, and we see the carotid sheath again in this region. I mean that some structures are in the depths of SCM and some structures are in the surface of SCM. External jugular vein and cutaneous branch, some branches of the cutaneous nerve of cervical plexus are on the surface of the SCM or lateral surface of the SCM, and the carotid sheath are in the depths of SCM. In this picture, it is from Atlas, Netter's Atlas. On the left side, we can see superficial structures, and on the right side, we can see deep structures from the SCM. One of the important clinical conditions is torticollis. In fact, it involves the sternocleidomastoid muscle. On one side, the muscle undergoes continuous contraction. This may have various causes. It can be congenital or spasmodic or spastic or neurological. This condition occurs as you can see in the image. The head is tilted toward the affected side and the face is turned toward the opposite shoulder. It is painful. Okay, here we have a region in the neck called anterior triangle of the neck. This triangle have some borders. In the superior, the lower border of mandible. In the medial, the midline of neck. And in the lateral, the anterior border of SCM muscle. You can see these borders in the picture. This is the anterior triangle of the neck. Now this region is divided by the hyoid bone into two regions, suprahyoid and infrahyoid regions. We have some triangles, some small triangles in anterior triangle of the neck. In this image, you can see the anterior triangle of the neck and suprahyoid and infrahyoid regions in the upper and lower position of the hyoid bone. Above the hyoid we have the suprahyoid region, and below the hyoid we have the infrahyoid region. These are also called the suprahyoid and infrahyoid areas. We have some muscles in these regions. Now we will explain the muscles that lie below the hyoid bone or in the infrahyoid area. These muscles are 4 in number on each side and are divided into 2 groups, superficial and deep. The superficial group is seen on the left side of the image. One of them is the omohyoid muscle, which rises from the scapula near the superior border of scapula close to the scapular notch. It has an intermediate tendon. As it ascends, it runs over the carotid sheath and receives fibers related to the neck. On the right side of the image, the deeper muscles are shown. The sternothyroid and thyrohyoid muscles. The sternothyroid arises from the monobrium of the sternum and inserts onto the oblique line of thyroid cartilage. The thyrohyoid continues from the oblique line of thyroid cartilage up to the hyoid bone. These muscles are inverted by the ansa cervicalis. Ansa cervicalis is a branch of cervical plexus. It is from C1, C2 and C3 of the spinal nerves. This innervation is essentially necessary for the movement of the muscles, and it is important. So we can conclude that we have 4 muscles on each side of the anterior triangle of the neck in the infrahyoid area: omohyoid and sternohyoid. Omohyoid and sternohyoid I show you with green circle, and thyrohyoid and sternothyroid I show you with blue circle. The first 2 muscles are in the superficial layer, and the second 2 muscles are in the deep to the superficial, and these muscles are very simple to understand. We now reach the suprahyoid muscles. These suprahyoid muscles are the ones located above the hyoid bone. I will describe them here so that you can recognize them and have no problem. They include the mylohyoid, stylohyoid, digastric, and geniohyoid muscles. You can see them here in different colors. For example, some of them have 2 bellies, such as the digastric muscle, which has an anterior and posterior belly, as you can see in the picture. In the left picture, the digastric is in green color, and mylohyoid is red and stylohyoid is yellow. In the right picture, you can see these muscles in addition of geniohyoid with blue color. These muscles, these four muscles, are in the suprahyoid area. The first muscle is the digastric, which is clearly visible in the image. You can see with blue circle in the picture. As I said, this muscle has two bellies, the posterior belly and anterior belly. The posterior belly arises from the mastoid notch of the temporal bone and runs downward and forward, then becomes continuous with an intermediate tendon. The stylohyoid bone arises from the styloid process of temporal bone and runs alongside of the posterior belly of the digastric muscle. It is pierced by the intermediate tendon of digastric, as you can see in the picture. These muscles help in widening of the floor of the mouth and assist in swallowing. In the image on the left, you can see the anterior belly. If we look at the floor of the mouth, we see that the mylohyoid muscle lies adjacent to the anterior belly of the digastric muscle. It is clear in both pictures. Okay, the next obvious muscle is mylohyoid. This muscle forms the floor of the mouth and is also called the oral diaphragm. It arises from the mylohyoid line on the inner surface of the mandible. The fibers of the two sides meet in the midline at the fibrous raphe and continue posteriorly to the hyoid bone. If you look at the image, you can also see its relations. On its superior surface lies the geniohyoid muscle. On its inferior surface lies the anterior belly of the digastric muscle. There is also a space here that is used submandibular space. The submandibular gland rests on the inferior surface of the mylohyoid muscle. This muscle is supplied by the mylohyoid nerve. It is a branch of inferior alveolar nerve. It is in the mylohyoid groove of the mandible bone. Its action is to elevate the hyoid bone and the floor of mouth during swallowing. If the hyoid is fixed, it can help depress the mandible. Next is the geniohyoid muscle. If you look just above the mylohyoid muscle, you can see two cylinder muscles lying on either side on each side of the midline. These muscles or geniohyoid muscles arise from the inferior mental spine or genial tubercle of the mandible and run backward to insert on the body of the hyoid bone. Their action is to elevate the hyoid bone and draw it forward during swallowing. If the hyoid is fixed, they can help depress the mandible. They are innervated by fibers from C1 that travel via the hypoglossal nerve.